Today is the 1038th day of uninterrupted daily webinar of IFPH. Hello all. Hello doctors, students and friends of homeopathy. Today we are having with us, our speaker is Dr. K. Shalini. She got graduated from Government Homeopathic Medical College, Bangalore. And she had a certificate course in children health, certificate course in gynecology and obstetrics, certificate course in skin and venereal diseases from BIMT, Pune, Maharashtra. Initially, she started her career from 2009 to 2015 as a duty doctor in Homeopathy Charity Center, Bangalore. And now she is the homeopathic physician at Nisarga Clinic, Bangalore, Karnataka. And today's topic is World Vitiligo Day, an international day against drug abuse and its homeopathic treatment. Let me welcome Dr. Shalini for the session.
Okay, sir, namaste. Namaste to everyone. Thank you so much, sir. This is a great opportunity for me because it gives a tremendous happiness, and the studying process also, it helps me so that I can achieve more in treating the patient. Friends, today we are going to study about the World Vitiligo Day and World Anti-Drugs Day. As you all know, like every year, June 25th is celebrated as World Vitiligo Day, and June 26th is celebrated as World Anti-Drugs Day. So first we'll study about the World Vitiligo Day. I'll be sharing the slides now. Okay, is it visible?
Yeah, it is.
Yeah, okay. Okay. World Vitiligo Day, as I have already mentioned, like every year it is celebrated on June 25th. So this year's World Vitiligo Day theme is Vitiligo looking into the future. So in our day-to-day practice, we'll come across this vitiligo, that is a leukoderma case in our clinical practice. Like it is such a disease that like females and males, if it is the deep pigmentation, that is the melanin is decreased in the skin, so it creates a white patches on the face, around the mouth, on the eyes, on the face, on the hands, legs. So it is such a like awkward, like it decreases the self confidence in the patient. So this is very important to know, like what is vitiligo. First, we'll know the definition of it. See, it is an acquired skin condition which is characterized by circumscribed depigmentation. As in the image, you can see the patient's hands are all like melanin is decreased. So it creates a white patches, kind of patches. And on the female patient, you can see in the image, like on the eyes, around the mouth, on the on the chin, on the hands, and around the nose, this like a deep pigmented patches are seen. So in some patients, there will be a complete loss of melanocytes from affected areas. It is found in all races across the world, and its prevalence may be as high as 1%. Its inheritance is polygenic. Usually, the cause of this white patches is it's a genetic disorder. It may be hereditary also. Like when the immunity is reduced in the body, we can see this like decreased melanocytes. So it is seen in all the races, like it is seen in small children also, in males, in adults, in females also. This condition is seen. So it is equally seen in male and females. The patches of the skin affected become white and usually have sharp margins. In the diagram, you can see the sharp margins. Typically both sides of the body are affected, like on the front, like on the chest, on the back also it is seen, on the hips also it can be seen, on the knee joints, on the elbows, like any part of the body these patches can be seen. Often the patches begin on areas of skin that are exposed to sun, like the body parts which are exposed to the sun, like hands, legs, and face, which are exposed to the sun, are more affected. And like I have seen in my day-to-day practice, like some male patients with this vitiligo, like on the thumb, it is seen. So it makes them their self-confidence is reduced by these patches. So as a doctor, like young doctors or the who are practicing, we have to build confidence in the patients, like whoever comes with vitiligo, like already their self confidence is reduced because of the females means they're like more of beauty conscious, and if these patches are there around the lips or on the face, like how their self confidence is reduced. So as a doctor, we have to build confidence in them. We have to convince them, we have to give hope to them, so that this condition can be cured, and if the treatment is taken. The next slide. See the types of vitiligo we'll study now. There are 5 types of vitiligo. The first one is the focal, you can see in the image. Second one is segmental. Third one is acrofacial. Fourth one is vulgaris. And the fifth one is universalis. In the focal, you can see like the patches on the chest. On the segmental, you can see the upper arm. In the acrofacial, you can see in the lower legs and on the both the hands and on the face. In vulgaris, you can see the patches all over the body. In universalis, the whole body, the melanocytes is reduced. Generalized, like this is the most common type of vitiligo that causes macules to appear in various places on our body. Generalized vitiligo means this is the most common type of vitiligo that causes macules to appear in various places on our body. And the segmental vitiligo means this type only affects one side of our body. See, you can see in the segmental, it is said this type only affects one side of our body or one area, such as our hands or face. You can see in the diagram, it affects one side of the body, such as hands or face. In the mucosal, vitiligo affects mucous membrane of our mouth and our genitals. Like mucosal means inside our mouth or on the genitals, it is seen. And in the focal vitiligo, it is a rare type where the macules develop in small area and don't spread in a certain pattern within 1 or 2 years. See, you can see it. And in the focal vitiligo is a rare type where the macules develop in a small area and don't spread in a certain pattern within 1 to 2 years. And the next one is the vitiligo, which is called trichome. This type causes a bull's eye with a white or colorless center, then an area of lighter pigmentation, and an area of your natural skin tone. Okay. Huh. The last one is universalis vitiligo. This rare type of vitiligo causes more than 80% of our skin to not have pigment. See in the picture, you can see universalis means the whole body, the melanocytes are decreased, which causes vitiligo. So I think you can see this. So these are the 5 kinds of vitiligo. Focal, I'll repeat, it's the focal, segmental, acrofacial, vulgaris, and universalis. So this is the types of vitiligo. Next, we'll study the signs and symptoms of the vitiligo. See, this vitiligo, it will not spread from one person to another. So it is not contagious. So when the person's immunity is reduced due to his genetic factors or hereditary factors and other lifestyle changes like lack of exercises and lifestyle changes like not eating food properly or dependent on the Western style of food eating, and lots of stress and strain causes vitiligo as an added factor. So you can see in the picture, see, The symptoms are patchy loss of skin color, whitening or graying of the hair, along with the when there is a white patches, the hair is also grayed in that area, and loss of color in the tissues. So vitiligo is a long-term problem in which growing patches of skin lose their color. It can affect people of any age, gender, or ethnic group. The hair from the skin may also become white. The discolored areas usually get bigger with time. So as the time goes on, as it gradually, those small patches, like small size, may increase in the size. Okay. I repeat, the patches of skin or mucous membrane, as I have told, like vitiligo is seen inside the mouth, also the genitals, also that lose color. This can appear white or lighter than your natural skin tone. So patches of hair on your body turn silver, gray, or white. Symptoms can be mild and only affect a small area of our body, or severe and affect a large area of your skin. Some people with vitiligo experience itchy skin before depigmentation starts. So, as in our day-to-day practice, when we get a case of vitiligo or leukoderma, it's the same. We have to do counseling of the patient as well as the family members, because the family members, like if they think like, what is this white patches? What I will get from it? Like, is it contagious? So, some type of mental trauma will be there. So, when we give awareness or the true facts of the vitiligo, even their relatives or the family members will also treat their the vitiligo patient in a proper manner. So the counseling is very important in this case. Okay. Now we are seeing the association of vitiligo. Along with vitiligo, what are the other association we'll see. So, what to know about vitiligo in children? If we have seen the vitiligo cases in small children, males and females also. So, mostly affect those with a family history. As I have already told, vitiligo is a cause due to hereditary and like genetic disorder. The causes patches of skin to lose to lose pigmentation, and we have to they have to take mental and emotional support for children affected. Like their parents should also give emotional and mental support to the children, and we have to do counseling of all the family members so that they treat their children or the a relative or the friend who is suffering from the vitiligo. This is diagnosed through a physical exam and other like by the visible, like vitiligo is diagnosed through the vision only. So the patient who is suffering from the vitiligo, there is a higher risk of depression, anxiety, and social isolation. When it is treated with the proper medicine, there is a chance the slowly recovery of the when the patches are it's increasing, and when they start taking the treatment, the patches sizes or can be decreased with the proper treatment of homeopathy. Okay, we have to keep an eye out on these areas of signs of vitiligo, like lips, as I have already told, lips, scalp, genital area, finger, and toe tips. So, these are the locations of vitiligo. Yeah. Other points of association of vitiligo is, like as I've already told, it is an autoimmune disorder. In adults with vitiligo, they may be suffering along with the vitiligo, the thyroid diseases, rheumatoid arthritis, type 1 diabetes mellitus, or type 2 diabetes mellitus. Psoriasis can also be associated with vitiligo, and vitamin B12 deficiency or anemia or vitamin D deficiency, and other patients along with vitiligo, they may be suffering with systemic lupus erythematosus and coeliac diseases, inflammatory bowel disease. So these are the associated diseases along with vitiligo. So this is very important. Like when a patient comes with vitiligo, we have to take the proper case taking. Sorry. Okay. When a patient comes, with vitiligo, we have to take the proper like case has to be taken, and we have to advise the other lab test or blood test. We have to advise to find out like what are the other diseases they are suffering, so that as a whole, as a constitutional, like any female patient comes with vitiligo, she may be suffering with hypothyroidism also. So when the correct constitutional remedy is selected by taking the proper case, the patient can be cured with the individualized remedy. So it's very important. Like homeopathy stands mainly on the case taking. So we'll treat the patient as a whole, not like will not treat the symptoms. Okay, next we'll be knowing about the risk factors of vitiligo. So, like, who are at the risk of vitiligo? As I have already told, the family history or the genetic disorder or hereditary, like any person in their family history, like mother side or father side, aunt side. Some will be having, so it may get like family history, the vitiligo can get the other person, like other autoimmune diseases, and like it is seen in small children also, male and female, boys or girls, and genetic factors and high stress levels, and the areas which are exposed more to the sun, and to this when exposed skin causes any skin injuries or sunburn, it acts as an added factor for the vitiligo. When they get a sunburn or the skin injury, it acts as a risk factor to vitiligo. Okay. Okay. Like what are the complications of vitiligo? So we'll come to know what are the complications of vitiligo. The people with vitiligo may be increased risk at social or psychological distress, as I have already told. Vitiligo patients, the associated symptom is the depression or the lack of self-confidence. Like they'll be worrying like, what is this patch, I'm not able, like females or males, like their appearance or the beauty consciousness, they are like females, as you all know, they are more of beauty conscious only. But when they get vitiligo, so obviously they'll go for depression, and the complications like sunburn, and along with that eye problems, hearing loss, like when it is more, and when it is associated with other diseases, they may get eye problems like diabetes, or any otitis media or otitis externa. Hearing loss in the older age is also seen. So these are the complications. Okay, causes I have already told, but I'll just repeat it once again. So the main causes of vitiligo is autoimmune diseases, as I've already told, when it is genetic factors are involved, and hereditary, and intoxication or any other drugs or medicine they are taking, and when there is iron and copper deficiency. Like any patient who comes with a case of vitiligo, we have to write down the lab test. Like we have to find out whether they are suffering from vitamin D deficiency or vitamin B12 deficiency, or whether they are suffering from anemia or the iron deficiency or the copper deficiency. Or any female patient comes, we have to take her menstrual history also, like whether she's suffering from heavy discharge, menorrhagia or metrorrhagia or fibroids or PCOD. This may also acts as a added risk factor for the vitiligo. And when there is worm invasions, sunburn, and when there is chronic inflammatory process, and the chronic disease of internal organs, endocrine and other sweat glands involvement also causes an added factor to the vitiligo. Okay. Now we'll know about the differential diagnosis of vitiligo. So what are the differential diagnoses? Like we have to know this to rule out certain conditions also. The first one is the chemical leukoderma. So they may be going some beauty procedures or in some chemical treatment for the Botox or fillers. Some females will be undergoing, and due to that also other skin conditions can be occurred, and we have to differentiate, and we have to find a leprosy. Leprosy is also very important. Like in leprosy, the sensation is decreased, but in vitiligo, the sensation is normal. So this is the differential diagnosis. And then the next one is lupus erythematosus, and next one is pityriasis alba. This is most common, like all over the chest, all over the front part and the back side. Pityriasis alba and the tinea versicolor. That is the fungal infection. So it is similar to the vitiligo, so like white patches, but we have to differentiate properly. And nevus depigmentus, post-inflammatory hypomelanosis, idiopathic guttate hypomelanosis. Okay. Natural course is unpredictable. Spontaneous repigmentation occurs in no more than 15 to 25% of cases. So these are the differential diagnosis of vitiligo. The first one is, as I have already told, chemical leukodema, leprosy, lupus erythematosus, pityriasis alba, tinea versicolor, nevus depigmentosis, post-inflammatory hypomelanosis, idiopathic guttate hypomelanosis. So these are the differential diagnosis. So we have to examine the skin problem, means we have to examine physically we have to touch, we have to see like what is the condition, whether it is tinea versicularis or any fungal infection or pityriasis alba. We have to touch the vitiligo patches, then only we can find out. So the sensation will be normal. It's just the white patches, and as I have already told, that will be circular in the shape, and the hair in that center also will be in silver or gray color. Okay. Gradually, it will increase in the size. Like I have already told, vitiligo diagnosis is usually done by looking at the skin during a physical exam. You might also have other tests, including blood test and skin biopsy, where a sample of your skin is sent to laboratory for further examination. A Wood's lab test, where a doctor looks at your skin under UV light to distinguish between other skin conditions like pityriasis versicularis, etc., which causes skin discoloration. As I have already told, any fungal infection, any tinea versicularis or pityriasis versicularis, it will be like a similar. So in Wood's lab test, we can differentiate. So you have to go to a proper experienced doctor only, so that your condition is to a proper homeopathic doctor, so your condition is diagnosed properly and the case is taken properly, and constitutional remedy when given, it will help in the in the treatment it will help in the treatment. Now we'll see the diet chart of the vitiligo. For the vitiligo patient or in any disease patient. Okay, but in vitiligo, the morning breakfast time has to be 9 a.m. I have seen in my clinical practice, like many female patients, they won't eat the breakfast only. Like they'll be busy with their household work and they will skip the breakfast. And the lunch also is skipped, and they will eat in the 4 o'clock, 3 o'clock, 2:30, they'll be having their first breakfast, which is very harmful to the body, because breakfast is the fuel. Because when we, whether the housewife, whether they are in home or they are working, breakfast is the mandatory, because when they don't take the breakfast, their sugar levels come down. Okay, because they'll be busy with their housework, they'll skip the breakfast. So this will act as a risk factor for the vitiligo, because in the older age, they may be, the females particularly, they may be suffering with the hypothyroidism, and they will not eat food properly, and it may cause diabetes also. hypertension also, and along this vitiligo is also another they are at higher risk. So at 11 a.m. They should eat some fruits or vegetables which is boiled and smashed, because that is the mid time, no, 11 a.m. So they have to eat some fruits or vegetables, and 1 p.m. is the lunch time. They have to eat some chapati, rice, chawal, dal, and 4 o'clock they have to take lemon tea or green tea or a black tea, which acts as an antioxidant. It gives energy to the body, and it will helps in the collagen production also. And 8 p.m. is the dinner time, so they can have chapati, rice, dal, vegetable kurma, or anything. This is the natural Indian diet, South Indian or North Indian. This will help in the proper balanced food. And along with this, the stress level has to be decreased. Like they have to do, ladies or gents, they have to do a daily half an hour, 30 minutes of yoga exercises, or at least walking, cycling, jogging, swimming, because physical activity is very much needed, because it will boost the happy hormone in your brain. It will increase the energy level, metabolism, digestion is improved by doing 30 minutes of just walking in the morning, 7 a.m. or 8 a.m. They have to do, like every patient when they come to our clinic, like any case, we have to advise the diet and lifestyle, because it is very important. Like they'll be taking all the medicines and they don't eat food properly, so then also there is imbalance. And when they take the food properly, and when they don't take medicine, and when they don't do any exercise, then also it imbalance. So we should be healthy first, then only our family will be healthy, and our family members will be happy, and that will give energy boost to do more and more work, which helps in the productivity in our life. So the total calories per day is 2730. So in the vitiligo diet chart, the calcium should be of 600 milligram, sodium 1200 milligram, carbohydrate 555 grams, and protein 60 grams, iron 70 mg, and the total fat is 30 grams. So the total fat, in the sense, they should not eat more of meat, because it adds more of fat. So the diet should be in a proper manner, because it should contain the carbohydrates, not the fat content more. Okay, fish can be taken, and eggs can be taken, fruits and vegetables, all kinds can be taken, which help in the complete diet in any person. Now we'll study the homeopathy case of vitiligo. In my clinical practice, the history is a 16-year-old boy presented to our clinic with a complaint of vitiligo patches on back since 8 months. He was not on any treatment. There was no family history of vitiligo in family. When I took the case and I took a complete picture, like maybe there maybe and maybe they didn't know. There was no family history. When I asked, um, apart from the main presenting complaint, he also reported recurrent tendency to take cold, and he was getting cold frequently. So this is the main. This was the main symptom which I got. And he was desiring only chicken and sweet, and he was not eating vegetables or fruits or nothing, but he was more of a chicken and sweet guy, I can say. And the thermals of this boy was chilly. He was very shy and timid, because when his first visit only I can make out, like he was very shy and timid person. He was lean, thin, and tall. He was tall and he was lean and thin, and he was very shy and timid. Like when I was asking any question, he was not at all answering, and his parents were answering. So my main which I got which helped my case to treat is the he was getting cold frequently, and he desires of chicken and sweet and thermals chili. And the mental is he was very shy and timid. In my first follow-up only, I could make out. Sorry, yeah. In my first, like when they visited me only, I could make out these symptoms. Okay. The following symptoms were considered for repetization. That is timidity, bashful, desires sweets, desires chicken, and the skin discoloration white, and the skin discoloration white spots, vitiligo, and repetization was done using Kent's repertory. The first prescription which I got was phosphorus 30C, and we gave him twice a day for 5 days. Basis of prescription, medicine selected as per repetization and in consultation with Materia Medica was phosphorus. Furthermore, phosphorus was prescribed as it covers sensitivity to cold and his thermal reaction was chilly. Therefore, phosphorus 30C was prescribed. In subsequent follow-ups, potency was changed based on the assessment of improvement of the patches. So basically, the boy was given 30C for 50 days, and like simultaneously when he came with the other follow-ups, the same medicine with different potency was given. Okay, the result is the vitiligo patches showed repigmentation on back. Like it was a miracle for me because like for every homeopath, what I advise is you have to take the case properly. Like that striking symptoms we have to get. That peculiar symptoms when we find only we can treat the patient. Like vaguely if we take and just a vitiligo, and if we go on giving any other medicine, it will not help. So the peculiar symptoms we have to ask the relatives of the patient also. The peculiar individual characteristic symptoms only helps in the diagnosis and the medicine which to be prescribed. And repertory, Kent's repertory, like what and all you take and you just repertorize and give that medicine, and definitely the result is seen. So there was improvement of the vitiligo patches with lower potency phosphorus 30C. However, much significant improvement was observed with higher phosphorus 1M potency. Vitiligo patches on back were completely resolved because he was a very young boy, and this phosphorus acted miraculously. So I advise all the homeopaths, like you have to take the case properly, take the peculiar characteristic symptoms, then only we can crack the case. Okay, so this was about the vitiligo case. So now I'll be dealing with the next subject, that is June 26th. That is International Day Against Drug Abuse and Illicit Trafficking. That was yesterday. This anti-drugs. Like what is drug abuse? So this is usually seen in younger ages, teenage boys and girls, because this is the age where they get affected towards the drugs, because that becomes a habit for them. So starting when they take the drugs, their mood is elevated. They feel happy, like enjoyable, jovial, but later on these drugs will harm them completely. So as the citizens of India, we have to educate or give awareness to the school children or the college goers or the adults about these drugs. Like they'll be seeing, like in the all the movies, they'll be showing like alcohol is injurious to health, cigarette smoking is injurious to health. On the packets also it will be written. but then also the adults will take this. And this cigarette, it contains nicotine, ethanol, sulfuric acid, phenol content is there, tartaric acid is there. So when that one smoke only, it will destroy the whole part in the body. Like due to cigarette smoking, it can cause oral cancer, lung cancer, and adjacent liver cancer, stomach cancer. And the boy with cigarette smoking also gets affected to like gets attracted to alcohol. So like it will become a habit, addict. It will become addict. So alcohol, daily consumption of alcohol damages the liver. So due to the cigarette and like when a person smokes, the adjacent people, like when he leaves out that smoke, the adjacent people will also get like when they take this smoke, even their body is also getting deranged. So along with this drugs like opium, ganja, heroin, so these are the deadliest drugs, because the small children or the school going children, they'll be not knowing what it is, and their friends advise them to take chalo take, it will be very nice, it will be very jovial, but they don't know. So when we see like we have to like, so every year June 26th is celebrated as anti-drug or the drug abuse awareness day. So we as a citizen of India, we have to educate the youngsters or our relatives or our friends, like what it is the drugs and what it causes. Okay, the people first should stop stigma and discrimination and strengthen the prevention. So, drug abuse, using drugs or alcohol in a way that causes problems. See, as we all know, it will become a dependence, experiencing withdrawal symptoms in the absence of drug use, like when they become addicted. And when we come to know and we advise them to stop, and when they stop the alcohol, cigarette, and there is withdrawal symptoms also, like it will become a thing like I can't live without drugs. If I take only, I'm normal. If I take only, I can't stop alcohol. I can't stop, like, because they have become habit. Addiction is there, and there is restructured brain functions leading to compulsive drug abuse despite negative consequences. Okay. So now we'll see what causes addiction. The friend circle, the environmental factors, any stress or strain. So this causes addiction. So it is illegal, like these drugs like ganja, heroin, opium, these are illegal. But some children may not be knowing, and they give money to buy these things to harm themselves. So we have to first educate the children. Like the cigarette, as I have already told and I'm repeating, the cigarette contains nicotine, ethanol, sulfuric acid, tartaric acid. The tobacco which they chew, it contains such a harmful chemicals, like it causes oral cancer, lung cancer, esophageal cancer, liver cancer, and it can cause stroke also, myocardial infarction also, liver cirrhosis also. And these drugs, what they cause is, you can see in the picture, when they become drug addict or the opium or ganja. So they the main like we have to find out, like in our friend circle or in our relatives or in our day-to-day clinical practice, when any patient comes, we have to see the symptoms, like spending more time alone, they want to be alone, like these are the symptoms of addiction. Losing interest in hobbies, like losing interest in studies, losing interest to mingle with people, losing interest to go for job, and not taking care of appearances. And we would have seen with the drug addicts, they will leave long beard and hair and they will not cut. So they are not bothered or not taking care of appearances, like not taking bath, not combing hair or not cutting the hair or not brushing, not eating the food properly. Due to heavy addiction, they will be sleeping the whole daytime, and in the night time they will be like they will not sleep in the night time. and sleeping for longer or less, eating more or less than usual. The physical, so these are the behavioral changes. And what about the physical and mental changes? There is a bloodshot or glazed eyes. So you can see the eyes with the bloodshot, and there is constant or recurring illness, so that boy or the girl will be falling to illness like frequently, and unexplained or frequent injuries, like they'll be like injuries causes, like they'll be addicted and they will fall suddenly, like when like they are addicted, no, when they're riding bike they'll just fall off, or on the staircase when they're walking or climbing they'll just fall off. And there is sudden weight changes also, and there is sudden mood swings. There'll be very aggressive, violent behavior, irritable mood, and anger will be so much, like they are not adjustable to the society or the people, because there is an irritable mood because of drug addict. There is anger, like there is a depression, and which can lead to schizophrenia. So these are the mental and physical changes. So first is the appearance we have to see, and physical, like any blood shots or anything, and there is a very sudden mood swings or sudden irritability, violent behavior, aggression, or the anger. So these are the symptoms we have to find out. So the main thing is they'll be very irritable, they'll not go to any work, or they will not listen to the parents or the teachers, and like they're like it's not like normal behavior, that is abnormal, that is against the society. So what we can look like having strong cravings to use drugs every day. So drugs they will take in the tablet form or in the powder form, or through the nose also they will inhale, or through the injections they will take. So that is antisocial activities. So having always having drugs with you, like they want it, like when it gets over, they'll start robbing in the family or in the house. They will rob money. So like it's becoming a different, no, like they have become thief and robbery. To take the drugs they are stealing money. So the small children like 16, 15 years, when they get addicted, so these are the antisocial activities which goes on. And buying drugs even if you can't afford them, like if even if you don't have the money, you'll borrow from some other people, like I want it. So that is the addiction, needing more of the some same drug to have the same effect. When they take also, like that same effect, that when they take the drug, the feeling is like they are in the happy mood, so that feeling is there in the head. So that feeling they want. So only they want that drugs. So when the money is not there, they start robbing or stealing the money, doing things you wouldn't normally do in order to get drugs, such as stealing or lying. So they start lying also. Stealing is also there, lying is also there. So there is a continuing to take drugs even though they are causing problems with your loved ones, like father, mother, work, or other commitments like family, wife, husband, children. So there is a disturbance only in the society. So these are the physical behavior changes, physical changes, mental changes we see in any alcoholic addict, cigarette addict, or drug addict. So we have to educate our youngsters, because youngsters are getting more attracted to the drugs, because maybe in some in the mobiles they may see, and without knowledge, or with bad company, these like addiction is becoming more. So we have to, like any relatives or friends, or in our day-to-day practice, when we see such case, we have to take the case properly, and we have to guide that boy, girl, or adult, or the family members, so that as a citizen, it will help us to build the nation. Like we have to stop all these things. Okay, one second. Okay. So these are the conditions of drug addicts. So we have to educate our friends or relatives. And the next is the homeopathic remedies for the drug de-addiction. The first one is the Avena sativa, one of the best homeopathic medicines for drug addictions when dealing with withdrawal symptoms or treating insomnia due to drugs or alcohol. See, this Avena sativa, it will really help in the alcohol addiction, as I have seen in my practice. To some extent, it will help, and it antidotes the effects of morphine or heroin, as well as of cocaine, tobacco, marijuana. These are the drugs, and Valium. So awareness sativa we have to keep in our practice because it will really help in the alcohol addiction. To some extent, it will help. In next one is Naxomica, homeopathic treatment for drug addiction with abdominal symptoms like nausea and vomiting, vertigo, with momentary loss of consciousness. Stomach is very sensitive to pressure when applied externally. Feeling is worse in the morning. See, as I have personally experienced Naxomica, it many patients we get in our practice, like they would have taken lots of medicines, allopathic medicine, and it would have created a complex condition in the patient. So first, when we take the case and when the patient has been taken lots of medicines of allopathy, and the complex side effects of that is seen. The first, when we give Naxomica, it will slowly decrease the that side effects or the complexity of the allopathic or the any other toxic medicines. It will decrease that toxic level. So Naxomica is very helpful. The next one is morphinum, homeopathic medicine for drug addiction with heart symptoms, throbbing in the heart, along with a small and weak pulse, a dream-like state, and patient feels indifferent. The next one is coffea, homeopathic medicine for drug addiction with a marked insomnia, like the patient doesn't get the sleep. Patient has phases of excitement, energy, ecstasy, sleeplessness on account of excess mental activity. And the next one is a very beautiful remedy, hyoscyamus, homeopathy treatment for drug addiction accompanied by hallucination and delusions. While patient appears intoxicated, he laughs, sings, recites, and babbles deliriously foolish act. So hyoscyamus, it will really help when we take the case properly and when we get these symptoms. No, like hyoscyamus will act miraculously. And the next one is the opium, suitable homeopathic medicine for drug addiction accompanied by drowsiness. The main symptom of opium, drowsiness, heavy, deep sleep, and noisy, labored breathing, loss of consciousness. Next one is the sulfuric acid. It's a very beautiful remedy. Homeopathic medicine for drug addiction with craving for alcohol stimulants, hot flushes, trembling, and cold sweats accompanied by humming and tickling in the ears, sore vomiting. So sulfuric acid will really help for the drug addiction of alcohol. As I have already told, Avena sativa and sulfuric acid will really help. And the next one is strychnine nitricum, indicated for alcohol poisoning or affections caused by excess alcohol. And the next one is Quercus gland spiritus, removes alcohol craving. And the next is caladium, removes nicotine craving, nicotine caladium, that is the cigarette. And the Daphne indica modifies alcohol craving. So these are the main homeopathic remedies. Which will really help in the drug de-addiction. Alcohol is the main. Like in our day-to-day practice, we'll get more of females saying that my husband is alcoholic. So when we take the proper case, taking is done, and when the peculiar peculiar symptoms we find out and constitutional remedy is given, it will really help in the case to get solved. So this is today's my topic of World Vitiligo Day and International Drug Abuse Awareness Day and illicit trafficking. Thank you. Hope you all enjoyed, or thank you so much. Thank you.
Thank you, Dr. Shalini. And today, the World Vitiligo Day and the International Day Against Drug Abuse together came today, and Dr. Shalini managed well, explaining how well, we can manage with homeopathic medicines, considering the peculiars, the rare generals, and the cardinals of homeopathy, using that. So it's wonderful. And it's the time for interaction with the speaker. Participants can go to the participant list. Raise your hands that I can unmute you for the interaction. As it is really a stumbling block for persons, for homeopaths, as when to deal with these drug abuse persons, even managing homeopathic medicines. If a person is a coffee addict itself, is a stumbling block. And that was the mindset of the really many doctors, many homeopaths are thinking like that. And when a person is afflicted, is being addicted to drugs, alcohol, tobacco in excess, or the very menacing other drugs which is being creeping in the society. These things, the mindset itself, we can control, modulate, isn't it, doctor?
Yes, sir. The mind is very important. What is our friend circle, or how we are thinking, and what is our cravings, it depends on that only. So our mind should be clear, and when we know the awareness, or when we give the awareness to the people, and when we come to know that this is dangerous or harmful to us, then only that willpower will help us to be away from these drugs. Whether it is alcohol, smoking, or tobacco, when we come to know and when we get that willpower, then only we can be away from such habits. And this willpower, as a physician, we have to build in our patients also. Like, there is a will, where there is a will, there is a way. So when we decide, like, I will quit smoking today, I'll quit alcohol, we have to build in our patient. That willpower will help than any other medicine.
Okay, so thank you. And Dr. Dhanesh is here. Dr. Dhanesh, please.
Good evening, all, and
Hello,
good evening,
sir.
Dr. Shalini. It's really a wonderful presentation from you once again.
Thank you, sir.
Because you have chosen the subject accordingly. Because this is the abuse day, you have chosen the.
Yeah.
I think some technical error is there, some network issues.
Yes, some so the minute to me now.
Yeah,
very difficult.
It's not clear, I think.
Oh, that's so. Okay, you may go to some other person. Thank you. Thank you.
Thank you, sir.
Thank you. And next is Dr. Hariharan.
Okay, doctor, your class is nice.
Thank you, sir.
Very nice class. Appreciate. First of all, I like to appreciate. And then see, vitiligo, we can cure the vitiligo, but it is very time consuming.
Yeah. Yes.
That we are facing. One of the main problems is
Yes.
time consuming. So we can cure it. But mental general, if you the mental general, and see if you prescribe accordingly, that vitiligo can be cured. I have the experience like that. Okay, that is good. But in case of drug abusing, I am facing one of the main problems, that the sensitivity of the mind is lost. Such persons. To regain the sensitivity, very, very difficult. I'm seeing very, very difficult. They have no sensitivity at all. Who is his father? The mother regarding, father regarding, brothers, or other person. They have no sensitivity at all.
Yeah.
They simply keep mum. They
Hmm.
have no reactions.
Hmm.
Such cases, what will medicine doctor? He has seen that the thing is that they have no reaction. If we
Yeah.
say something, they will simply simply sit like this. By anything we ask, no reaction and no reply.
Okay. 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 Sir, it is seen in a very severe conditions of drug addiction, like gazed vision, like they'll be staring at one point. Maybe they'll be suffering from depression, and it may like further like schizophrenia or multiple bipolar disorder or monopolar disorder. So the main thing, like we have to advise them for the stress has to be decreased, like by doing yogasanas,
Correct.
meditation.
Meditation.
So these are the main and general things, like meditation they have to do. They have to do Om chanting, because I have seen in many of my patients, Om chanting has helped so much in their life. Like Om chanting they have to do, like yogasana they have to do, breathing exercises like Anilom Vilom, like Kapalbhati. These exercises, like it will show, like this will not, like we think, or Kapalbhati, what it will help, what only breathing water, but it will help in a very larger extent. Meditation, Om chanting, just sit and just recite Om chanting. That will help, like 50% the patient is cured because of meditation, yogasana, breathing exercises, Kapalbhati, Anulom Vilom. So this will definitely help in any addiction of alcohol, cigarette, or anything. It will improve the positive, they'll be filled with negative thinking. They'll be filled, the family members, the whole family will be of full negative. When they start chanting the Om chanting or the meditation, yogasana, it will bring positivity in their life. When the positivity is there.
Thank you, doctor.
Yeah, when the positivity is there, so it will help the patient to recover.
Yeah,
Sir,
and the next thing I need to add is, if well-selected medicine is there, the medicine itself counsel the person. No need the will or intellect or anything for us to be clear for the person or the patient in front of us to get corrected. If the medicine is exact simillimum, the right simillimum will hit the bullseye and everything will be okay. And I differ from Dr. Hariharan itself that there is nothing there connected with vitiligo, that it is sometimes some cases will be slow, sometimes some will be fast. The exact selection of the medicine, if the medicine is a real force for us, and we are not sticking to our self-play for that case, and if that it is a case of the exact force, the change will be very soon, it will come very fast. Thank you. And I need to welcome Dr. Manoj for the vote of thanks.
So one more thing, like one question is there. Yeah, sir, on every June 26th, government has only given regulations, like in every schools and colleges, we have to do awareness program, like as a doctors. And I have done yesterday in one of the government school, I did the awareness program by making a skit for them, or singing and dancing, and giving the slogans like no drugs, yes life, so that it will like the awareness is given. So not only me, others are also doing the awareness program. So when in the schools and colleges the awareness program is given to the youngsters, they'll come to know about what it's the drugs, and how harmful it is. So we need to do that, and government has already implemented.